what we saw, and I'm sure you see it every day, in Savannah alone, I'm sure in Long Island, there are a lot more, but in Savannah alone, there are 23 hospice companies. So what we're going to be the 24th? I mean, what were we going to do different, right? The model is dictated by what Medicare, will reimburse. And so for us, it was, all right, we can't fix that model. There's nothing we can do about that. Everybody else is trying, big, business, Wall Street's trying, everybody's trying to figure out how to change that. So let's do it differently. Let's go after the gaps. Let's look at what people aren't getting from that traditional model and create that.
I would even say it's supplemental to what they're doing.
Yes.
And so we
don't replace it by any means. We don't even try.
We actually, like to say that we are like hospice care support. Like we'll go alongside a hospice company and support the wonderful work they're doing with, more caregiving, because a lot of times people see hospice coming on board and they think, okay, well, there's going to be somebody here with me all the time now, and that's
I've got hospice taking care of it.
That's just not true. The hospice nurse is going to come once a week, and they might send a CNA once a week for a shower. Families need a lot more than that, so we're able to supplement in the caregiving around the clock if that's needed, more nursing support with our nurses as well. And, one thing you mentioned earlier was patients needing to go into the hospital for IV fluids or something like that.
Or IV medication,
IV medication, that is something too we're able to offer at Coastal Care Partners through private duty nursing. So our nurses and nurse care management act more as an advocate or consultant, but what's great is that we can also flip to private duty nursing, so we can do IV antibiotics at home, IV fluids at home, wound care at home. All of these like traditional nursing skills could also be done at home and keep them out of the hospital.
And the way the licensing for that works here is just get a doctor's order. So if they've got a doctor and we call their doctor and say, hey, listen, your patient is, exhibiting this. The doctor say, okay, I'm going to send over orders for you to do this, that, and the other private duty. And it's a beautiful, setup there when we can just pivot the nurse cap from, advocate to actual hands-on nursing.